differentiated healthcare providers between frontline and non-frontline as on today. So this will be, I'm presuming they are all healthcare providers. They will be given the vaccine first. Amongst them, pregnant ladies and breastfeeding women are advisable to take vaccine based on their risk versus benefit. That means they may not allow the vaccine in the first 3 months, but after 3 months they may allow based on the risk versus benefit. All patients who are immunocompromised, both the viruses are non-live, can be given. One is killed and one is non-replicative virus. So both the vaccines can be given to all. No testing is required while doing a corona. That means if you have suffered, if you are antibody positive, you have suffered from a mild asymptomatic illness, you need not go for an antigen test or antibody test before the first dose. If you know that you have suffered a corona and you know your dates, it is advisable to take it after 3 months. In the first 3 months of an active disease, they are discouraging. The reason being you already have adequate antibodies. Now, what are the risks? Let us understand what are the risks involved. One is, I've said, multi-system inflammatory disease. Now, how does multi-system inflammatory disease develop? You have two types of antibodies, neutralizing antibodies and non-neutralizing antibodies. Suppose you develop neutralizing antibodies, they will kill the virus. When you develop non-neutralizing antibodies, they don't kill the virus, but they allow the cytokines to kill the virus. So non-neutralizing antibodies can produce a cytokine reaction in the body when the virus enters. Something like multi-system inflammatory disease after the virus is gone from the body. When the new virus comes, if you have a neutralizing and non-neutralizing antibodies, you have a antibody enhancement disease complex which was seen in dengue vaccine. So that is what they are saying, watch for it. That is much more likely to happen in mRNA or a DNA vaccine, less likely to happen in vector and kill vaccine, but there is a theoretical possibility that after the vaccine, so therefore, now the subject where will be the next topic of subject will be how to assess after the vaccine, have I developed neutralizing antibodies or not? That tests are available. If you want to check your neutralizing antibodies, that kit costs 1,000 rupees because the government says you cannot charge more than 250, but the kit cost is 1,000. The test is not entering the circulation, but that test is available where you can check whether you have developed a neutralizing antibodies or not. So the next discussion, once the viral takes over, amongst the medical fraternity will be, every patient will come back and say, hey doc, tell me, have I developed antibodies? If yes, are they neutralizing or not? Are they not neutralizing? What do I do? At this moment, everybody is asking only one thing, should I take it or not? Nobody is talking to you post-vaccine. People are talking about, so there was a phase of COVID. Then people started asking how to manage post-COVID. Now people are asking only one question, should I take it or not? After a month or two, people will start talking, have I developed antibodies or not? I am in the 70 or in the 30. So these are the situations we are going to face over a period of time. I was working on this for the last 3 months. Now I am working on what is going to happen after 3 months. So all my studies now are preparing that what will happen, how to pick up neutralizing antibodies, non-neutralizing antibodies, how to do
that. Sir, can I ask one question, Dr.
Yes,
from Kerala?
Yes, sure.
Yeah. So you said that if the patients are in the initial first 3 months of COVID infection, they have had a mild infection or they did not even know about it, it is not necessary that they should take it immediately. They can take it later. In that case, wouldn't it be better to, if people, they never knew that they had COVID. If it would not be better to check the antibody status before giving COVID vaccine? The
I know,
antibody
but government cannot do that now. How will you get the money for testing the antibody?
വേറെ ഡയറക്ടർ ഉണ്ടെങ്കിൽ ഞാൻ പറയാം.
That is not possible as a that's not practical. That's not practical. Those who can afford, they will do that.
So
Those who can afford, the top 20 people already knows their status. See, I've done my antibody test 4 times. I know I'm negative. So people who are rich, they already know their status. I'm talking about people who can't afford anything. How can they afford an antibody test? The antibody test will cost more money than the vaccine.
okay.
Sir, can it be given to children below 12 years?
As on today, less than 18 years, no vaccine to be given. They don't need it because they are on the least priority list because they don't transmit the infection so much. Only Bharat Biotech is doing a study in children. But at this moment, less than 18 years of age, if somebody asks us, never say that vaccine will not be given to children because they will get into a psychological trauma. So answer is they don't need it at the moment. That's a positive answer. Because at this moment, they don't need a vaccine. A, they are not infectious. B, mortality is not there. So if we are going to say children will not be given, we are creating them into a mental stress. Why not? Why not? Why not? The answer is you don't need it now. And they may not need it in future. Time will tell us for children. At the moment, no vaccine is being prepared for the children. WHO has considered children at this moment are not a priority list. They are non-infectious and their disease is very, very mild and they become negative within 2 to 3 days.
So is the cutoff age 12 years or 18 years?
12 years.
Thank you.
But at the moment, cutoff age for adult is 12 years, but for vaccine, it is 18 years. Some are saying 16, some 18. Pfizer and Moderna has a cutoff age of 16/18. In India, it is 18, not 12.
Yes, sir.
What about pregnancy, sir? Pregnant women can take the vaccine.
Can?
Pregnant
So
women.
it is,
I already said pregnant lady and breastfeeding women will have to assess their risk. Remember one thing, that a menstruating woman is at a least risk of death. A menstruating woman is at the least risk of death. Now, they will consider taking a vaccine to save the child, not for themselves. So therefore, this is decided on a case-to-case basis. This is healthcare workers should take it. Reason being that if they develop a disease, the child will be at risk of developing it if it is 1 year, 2 years old. Therefore, the CDC guideline says that it is not a must for them, but they should consider taking a vaccine, except in the first 3 months, because where you don't know that whether it virus can cause any congenital anomaly or not.
Thank you, sir.
Any contraindication for people with allergic to meat?
At this moment, allergy to Moderna and Pfizer, once it is available, you are supposed to do a scratch test, then intradermal test, like we do it for penicillin or sulfa drugs. Then you give the vaccine. Regarding these 2 vaccines, killed vaccine and this vaccine, the directions have the government has not issued the directions. Their chances of anaphylaxis will be the same as that in any other drug. 1 in 10 million. In Moderna and in Pfizer, it is 1 per million, which is 10 times the reaction than a normal one. So you expect a reaction in a vaccine of, the reaction of a vaccine will be the same as in a flu. That is 1 in 10 million. Flu vaccine causes reactions of 1:10 million.
sir, Marthandavilla sir had asked me to convey his regards to his traveling, so he was not able to
Thank you.
participate. I request Dr. Babu Ravindran, past National Vice President and our senior leader, to give a few comments. Babu Ravindran sir.
Dr. K.K. Agrawal, it was a great moment for all the doctors of Kerala. Well information and a study report. I think majority of most of the doctors have had a clearance of all their doubts. And thank you very much, because this is all of them are concerned about themselves and their parents and their parents and their relatives. Now that the doctors are getting their first priority, most of them are concerned about the others also. And you told that about if 30 crores are covered, the herd immunity will be there and that will take care of other things. All those informations are highly beneficial, sir. Thank you very much. Once again, thank you very much. Thank you.
Now our first webinar is coming to a close, and I once again thank Dr. K.K. Agarwal sir for his excellent presentation. Now I request our State Secretary Govima to present vote of thanks.
Yeah, good evening and respected State President Dr. Sakaria, K.K. Agarwal sir, that was an excellent presentation, and probably most of our doubts have been cleared, and we thank very much on behalf of Indian Medical Association Kerala State Branch. We thank very you for attending and presenting all these matters to us. Thank you very much, sir. And Dr. Rakesh also, on a short notice, he came and presented the logistics and of vaccination strategy. Thank you, Dr. Rakesh. And this is as Dr. JK has already mentioned, this is the first of the series, and we'll be conducting the series, continuing the series often. And I take this opportunity to thank each and every member who has attended this meeting and made it a grand success. Thank you, one and all. Thank you very much.
Thank you, everyone. Agarwal sir, once again, thank you.
Thank you.
Thank you for all the participants.